was on the 15th. I was actually admitted on the 14th already, and then the 15th, at around about 10 o'clock, I was pushed into the theatre. And before that, we asked if my husband was allowed to even just see the baby. Unfortunately, he wasn't even allowed in the hospital. He was only allowed in the parking lot. They came in and I said, okay, so after everything's done, can I let him know so that he can come in and just see the baby even through the window? And they said, unfortunately not. I was the only one allowed inside. I was the only one allowed to go near the baby. That was even a whole procedure. Washing hands, sanitizing, putting on a gown, putting on gloves, mask. You didn't even actually touch your baby. It's more like you're seeing your baby through another glass. It's really not something I wish upon any mother going through it. Yeah, sure, the sisters, they were very nice. They really supported me in every way they could. But knowing that the father is there, that support system that's personal to you is there, means everything. While they're even busy operating, he's there to calm you down. I get panic attacks, so I shiver like crazy. And with him being there, talking to me, telling me to calm down, relax, you can do this, it really helps a lot. Where with COVID, there's only the sisters, the doctors, and they're so busy concentrating on what they're doing that there's nobody to talk to, there's nobody to help you through it. A sister came, she showed me the baby for a few minutes and baby was gone. I was in for 3 days, the normal 3 days, and then baby was there for a week. His lungs was underdeveloped, so they had to have him on oxygen. He had jaundice, so he had to get through that as well. It's a picture I wish for nobody to see. Just seeing a baby there with oxygen on, and I mean, it looks like a whole helmet that they're wearing. So you can't really see their face. If they cry, you want to pick them up, you want to hold them, you want to tell them it's going to be okay, and you're not allowed to. You're not allowed to touch them. You're only allowed an hour with your baby. You're not allowed to be there any other time except between 3 and 4. It wasn't knowing that this was going to happen. And if I'm even going to pick up COVID in the hospital, even though there's nothing, they haven't had a case there, you never know. And then, is my baby going to be fine? Is the father actually going to see his child ever? Sleeping next to a phone every single night until baby is home, wondering, are they going to phone you? Are they going to tell you something happened? Daddy hasn't seen baby. I've only seen baby for an hour a day. So what happens after this?
So I gave birth the 15th of April. It was a really good experience. I gave birth with a midwife. We did a stretch and sweep early in the morning, about 10, and he was born 7 minutes past 5 in the afternoon. Very, very quick labor. A birth with a midwife is a more caring environment. I felt that the hospital was very cold, so I wanted to be cared for, to have a birth that was beautiful, without weird interventions. It was a birth house, so I went from the tub because it was a water birth. My husband got skin to skin while the midwife was attending to me to see if I tore or something. So then we all just lie on the bed. They call it a cuddle puddle. So all of us just lie on the bed and you start breastfeeding, which was very important for me. We're all just together, and that's what mattered. My mental health is really suffering. I do suffer from postpartum depression. I had very bad, very, very bad postpartum depression with Emily. You constantly feel anxious, like, would it not be better that I'm not here? That's literally what goes through your mind, and the fact that you can't get out, really, it makes it worse. You feel like you don't, like you must be dead. Literally, that's what goes through your mind.